If you finally want to walk farther again without stopping every 10 minutes, but your legs keep going numb, your back tightens the longer you stay upright, and your stride keeps shrinking no matter how hard you try, then what I'm about to show you is going to feel like a turning point. Most people think they need complicated exercises, but that's not actually why you're getting stuck. After 35 years of helping people with spinal stenosis, disc herniations, and degenerative spine conditions walk longer with less pain, I've seen the same hidden pattern again and again. And once you understand it, the fixes become shockingly simple. In this video, I'm going to give you 5 specific fixes that immediately reduce nerve pressure, stop the numbness from building up, and help you walk noticeably farther. Each one targets a different reason your symptoms built up while walking, and together they make it much easier to stay upright longer without everything tightening, shrinking, or going numb. You do not need to get down on the floor, you will not need equipment, and you will not need a long routine. Stay until the end because I'll be giving you one bonus fix that stenosis patients swear by, the technique that helps them survive grocery stores without having to stop every aisle. Stay tuned. Before we get into the fixes, you need to understand why your symptoms show up the way they do. This is the part most people are never told, and it often brings a lot of clarity and relief all by itself. Lumbar stenosis is simply a narrowing of the spaces in the lower back where the nerves travel. It's extremely common after age 60. It can come from normal wear and tear, from arthritis, disc changes, or just the natural aging of the spine. None of this means you've done anything wrong. Here's the important part. When those spaces are narrower than usual, the nerves become more sensitive to pressure. Walking puts your lower back into a position that increases that pressure, not because you're walking incorrectly, but because the act of staying upright places more load on the structures around the nerves. That rising pressure is why your legs start to go numb, why your back tightens the longer you stay upright, and why your strides slowly get shorter. This also explains why leaning forward on a counter or a shopping cart feels so much better. That small forward bend opens more space around the nerves, less pressure, fewer symptoms. Your body already knows what helps. You've probably felt it many times. So if you've ever felt frustrated because you can only walk 10 minutes before everything tightens, or worried because your legs feel weak or tingling, or discouraged when errands take twice as long because you have to keep stopping, this explains it. It's a nerve pressure problem caused by the narrowing in the lower back. And once you understand that, the 5 simple fixes you're about to learn make a lot more sense. Each one helps you manage the pressure at the moment when symptoms normally build up. Stay with me because the next part is where you can begin to feel real improvement in how far you can walk and how long you can stay upright. The first of the 5 simple fixes is something I want you to do before you start walking. Think of this as taking pressure off your nerves before they get irritated. If your legs usually go numb or your back tightens after a few minutes, this prepares your spine so you can walk longer with less discomfort. Here's what to do. You simply need something to lean on. This could be a kitchen counter, or if you're at home, it could be a shopping cart, a sturdy railing, a parked car, even the back of a bench if you're out in public. Place both hands on the support in front of you. Step your feet back slightly until you feel steady. Then gently lean your chest forward and let your lower back soften and open. You're not bending far, you're not stretching hard, you're just giving your spine a chance to move into a position that feels relieving. Hold this for 20 to 30 seconds. Here's why it works. With lumbar stenosis, the spaces around the nerves in the lower back are narrowed. When you bend forward even slightly, you open those spaces, you reduce pressure on the nerves. This often means less early numbness, less tightness, and a calmer start to your walk before you even begin. Many people notice their legs feel lighter and their back feels less guarded right away. Now, here's what to expect. This should feel relieving or at least easy to hold. You may feel a gentle stretch in your back or your hips. That's normal. If anything feels sharp or increases your symptoms, stand up a little taller, make the movement smaller next time. The goal is to give your nerves a more comfortable starting point so you're not fighting symptoms right away. Now, again, bear in mind this is for spinal stenosis. That's a narrowing of either the spinal canal or the opening where the nerves actually come out. That's what stenosis means, narrowing. It is different from a disc herniation or bulge, and this is why there's no one-size-fits-all exercise for everybody. If you have a disc herniation or disc bulge, then this is exactly the opposite of what you want to do, because that disc bulge or herniation is like a jelly donut. If I squish the front, the disc is coming out the back. So again, that's why exercises need to be specific to you. Now, next we're going to move to the simple fix, the mid-walk reset, which helps you settle your symptoms the moment they begin to creep in while you're already out walking. Now, most people with lumbar stenosis notice that their symptoms start slowly. It's a little tightness, a little heaviness, maybe a tingling feeling. If you ignore those early signals, the symptoms build until you have to stop completely. The mid-walk reset keeps that from happening. So here's what to do. When you feel the first sign of tightening, numbness, or heaviness in your legs, pause and lean forward on whatever is available. Again, it could be a shopping cart, a railing, a wall, the top of a parked car, or even placing your hands on your thighs while slightly bending forward. You let the lower back round gently and hold this position again for 20 to 30 seconds. Keep your breathing relaxed. When the symptoms ease, stand back up and continue your walking. Now, here's why that works. Standing upright increases pressure on the nerves in that narrow spine. Leaning forward opens the space and gives the nerves a break. So doing this early interrupts the buildup before it becomes overwhelming. It prevents you from having to completely stop your walk, to cut your errands short, or to have to find a place to sit. Think of it as releasing steam before the pressure gets too high. Now, here's what to expect. Most people notice their legs feel lighter and their back loosens within 20 to 30 seconds. You should feel a sense of relief or at least a clear reduction in symptoms before continuing. If you feel uncomfortable leaning forward, make the movement smaller and use a higher support like a cart or railing. The goal is not to stretch hard, it's to create space and calm the nerves so you can keep going. Now, next, we're going to move into the third simple fix, which helps you regain your stride and prevent the short, shuffling steps that many people notice as their walk goes on. Now, many people with lumbar stenosis notice that their steps get shorter the longer they walk. The legs feel tight, the hips feel stiff, it can feel like your body's trying to protect itself. This fix helps wake up the muscles that control stride length so you don't fall into that shuffling pattern. Here's what to do. You can do this standing or seated. If you're standing, use, again, a counter, a cart, a railing, or even the side of your car for balance. Step 1 foot back a small distance. You're going to lean the chest forward slightly, and you're going to gently tilt your pelvis backwards, the top of the pelvis, so that your lower back rounds a little. Then shift a little weight forward and back for maybe 10 to 12 reps. Switch sides and repeat. If you're seated, you're going to sit near the edge of a chair or a bench. Again, you're going to place your feet flat on the floor, gently lean your chest forward and tilt your pelvis backwards so that the lower back rounds slightly, just like the standing version. Then shift your weight forward and back in a small, controlled motion, again for 10 to 12 repetitions on each side. Now, here's why this works. When symptoms begin, the muscles that help you take a longer step often shut down or tighten up. This makes your stride shorter and your walk feel more tiring. These gentle movements wake up the hip flexors and the glutes, which help open your stride and reduce the tension that builds with each step. This means less shuffling, more control, and a more natural walking rhythm. Here's what to expect. You should feel smoother movement in your legs and hips within a few repetitions. Some people feel a mild stretch or warmth in the hips or the thighs. That's normal. You should not feel sharp pain or increased numbness. If you do, make the movement smaller or use the seated version until it feels comfortable. The goal is to restore a more comfortable step length so that you can continue walking with more stability and less effort. Next, we're going to move into the fourth simple fix, which helps you calm your back and legs after errands so you do not feel stiff or overwhelmed by symptoms on the way home. Many people with lumbar stenosis describe returning to the car feeling stiff, sore, or even a bit overwhelmed by symptoms. This fix calms your back and legs before the irritation has a chance to linger. Here's what to do. You're going to sit in your car or in any chair or bench. You're going to slide your hips slightly forward towards the edge of the seat so you have more room to move. You're going to place your feet comfortably in front of you. Gently lean your chest toward your thighs and allow your lower back to round. Again, remember, everything we're doing is to actually cause flexion at the spine. So you're bending forward, you're opening up that pressure that's putting pressure on that spinal cord and on those nerves. You're going to hold this position for 20 to 30 seconds while breathing slowly. If you prefer, you can place your elbows on your knees for a little extra support. Here's why it works. After walking, the lower back has been under steady pressure. Sitting upright often keeps that pressure in place, which makes your symptoms linger. This gentle forward lean opens more space around the nerves and helps your back relax. It gives your system a chance to reset before the stiffness sets in. Most people are never shown a post-walk option, even though this is one of the times when symptoms flare the most. That's why many people feel worse after shopping or doing their errands. They never take a moment to release the pressure they built up. Many people feel relief almost immediately and notice they can get out of the car more comfortably when they arrive home. Here's what to expect. They should feel easy and relieving. You may notice your back muscles soften and your legs feel less heavy after a short hold. You should not feel sharp pain. If leaning forward feels difficult, use a cushion or a folded jacket behind your lower back for support and make the movement smaller. The goal is to lower nerve pressure and let your muscles relax so you can recover more quickly. after any activity. Next, we're going to move into the fifth simple fix, which gives you a reliable way to reduce pressure even if you can't get on the floor. The fifth simple fix is for anyone who needs relief but can't get on the floor. This is one of the most common concerns people share with me. Many have arthritis in their knees, limited balance, or simply don't feel safe getting down and up from the ground. You still deserve a way to ease your symptoms, and this fix gives you that option whether you're at home, at a restaurant, at the mall, or simply sitting in your car. Here's what to do. Sit in the chair, on a bench, or in your car seat. Sit comfortably and place your feet slightly forward. Lean your chest gently toward your thighs and allow your lower back to round a little. Rest your hands on your knees or thighs for support. This position immediately reduces pressure on the lower back without needing the floor, equipment, or any setup. Here's why it works. Lumbar stenosis symptoms often flare when the lower back stays upright for too long. This seated forward lean takes strain off the joints in the spine and opens more space around the nerve. It works for the same reason leaning on the cart helps during shopping. You're giving your back the shape it prefers. Many people find this position calming, especially during errands or when symptoms show up suddenly in public. Here's what to expect. They should feel gentle and relieving. You may notice your back muscles relax. Your legs will feel lighter within 20 to 30 seconds. Be patient. If leaning forward is uncomfortable, make the movement smaller or rest your elbows on your thighs for support. The goal is to reduce pressure and settle your symptoms in a way that feels safe and easy wherever you are. Now, next, we're going to go into the bonus fix, the one technique that people with stenosis tell me they rely on more than anything else when they're out in the real world. The bonus fix is something almost every person with lumbar stenosis discovers on their own, usually out of desperation in the grocery store. The reason I'm including it here is because people often feel embarrassed when they have to do it, but they should not. Okay? The simple position works better than almost anything else when you're out in public and your symptoms start to build. So here's what to do. When you're using a shopping cart, place both hands on the handle and let your chest come forward slightly as you walk. Allow your lower back to round a little and keep your steps comfortable and steady. If you're not using a cart, you can use a stroller, a rolling walker, or even lean gently on the back of a chair or a bench in the store if you need a quick break. The key is the small forward lean that gives your nerves that more room. Remember, for opening up that space, it's taking pressure off the nerve. And that's exactly why it works. The cart gives you support so your back muscles can relax, and the forward lean opens the spaces in your lower back that tend to tighten when you walk upright. Many people tell me the only way they can make it through a full grocery trip is by leaning on the cart. It's not a sign of weakness. It's a smart, effective way to control your symptoms and stay active in the real world. Every person with stenosis understands the difference this makes once they try it. Here's what to expect. You should feel lighter in your legs, less pressure in your back, and a more comfortable walking rhythm. If you feel unsteady, slow your pace or stop and lean forward slightly with both hands on the cart. Use this as often as you need. It's there to help you, okay? Not to make you feel self-conscious. The goal is to make errands possible again without feeling overwhelmed by symptoms. You now have 5 simple fixes that help you reduce pressure, control your symptoms, and walk farther with more confidence. These techniques give you real options in the moments when you need them most, whether you're at home, running errands, or out in the community. Try them out and let me know how they worked for you. Drop a comment and share what changed for you, even if it's something small. The small wins matter. If you found this video useful and got value from it, please like and share it so more people dealing with stenosis and walking limitations can get the help they need. Be sure to subscribe if you want to learn more tips and strategies on how to treat and relieve debilitating back and neck pain without drugs and without surgery. And remember, spinal stenosis is a serious condition that can continue to progress with time. And for some people, it can eventually lead to surgery. If you want to see how to treat this conservatively and avoid surgery when possible, check out the next video. It shows how we're able to help people with spinal stenosis and disc herniations with a 94.3% satisfaction rate. Please go watch that video next.